हाय गाइस, वेलकम बैक टू माय चैनल। कैसे हो आप सब लोग? मुझे कमेंट सेक्शन में ज़रूर बताना। और गाइस, आज की जो ये वीडियो है वो एक इंफॉर्मेशन रिलेटेड वीडियो है। तो गाइस, आपने देखा होगा कि द पीपल आपके घर में या फिर आसपास में पीपल सफ़र फ्रॉम स्ट्रोक एंड हाई ब्लड प्रेशर। तो गाइस, वी विल डिस्कस अबाउट हाई ब्लड प्रेशर। बाद में हम डिस्कस करेंगे अबाउट द स्ट्रोक। सो yes, what is a high blood pressure? As we know that arteries supply blood to different organ. Blood is the major source of body. So nowadays hypertension, that is high blood pressure. In medical term, it is also known as hypertension. So it is very common nowadays, especially from school days. School going children are also suffering from high blood pressure. There are various reasons why you can suffer from high blood pressure. um, Temperature, stress, smoking, a lot of carbon dioxide in your body. There are many other factors why you are suffering from high blood pressure. So when this blood goes through the artery, um, and the pressure is high, means normal blood pressure is 120 by 80 mmHg. So at certain age 140 can also be normal, but more than um, um, 120 at the age of 20 or 25, and more than 140 at the age of 50, more than, like, you are at the age of 50 and your pressure is 150, 60 or 170, then you can say you are hypertensive and you are suffering from high blood pressure. Yeah. Heat, temperature is also one of the factor why people suffering from high blood pressure. Normally the question that has been raised, that I am suffering from high blood pressure, can I get a stroke? There's a chance of getting a stroke, yes. Definitely, if your pressure is high, then I don't say in every case you will get a stroke, um, but there are chances to people who are suffering from high blood pressure, they might get a stroke. Actually, it's blood tendency to form clot. So when there is a formation of clot in the supply, in the blood supply, uh, there is a formation of clot, and that clot obstruct the supply of blood. When there is an obstruction uh, to the supply of blood, um, there is less oxygen supply to the tissue and cells. So it is definitely like that. Water is being flowing in the pipe, and there is some brick or obstructing the water to move in the pipe. So it causes pressure around the walls of the pipe, and then it causes leakage. So it is something like that. Just an example. There is less oxygen supply to that region. You can say they suffer from mild paralysis because of lack of oxygen supply to that region. And when you just go to doctor and they say that yes, the patient is suffering from stroke. So what are the management of stroke or hypertension? First of all, um, if you're hypertensive, then definitely you should regularly check your blood pressure. You should have a BP, that is blood pressure monitoring device, along with you always whenever you are out and for work or something. And you should carry your medication. So anti-hypertensive medicines are being prescribed by the doctors. I will not say the name because definitely you have to consult the doctor and then you should consume um, hypertensive antihypertensive medicines. Normally normally if you see, there are, depending upon your case, doctor prescribe you medicines, antihypertensive drugs like amlodipine, telmisartan, and ayurvedic medicines like sarpagandha, depending upon your case. But you have to consult your doctor before consuming any kind of medicines, that is antihypertensive medicine. And drinking coconut water, um, cold water really helps reduce the salt intake while when you're suffering from this high blood pressure. Reduce the salt intake in your diet, um, consuming it. So just stop salt. um, there is two cases, um, hypertension and hypotension. These two are different topic. Hypertension is something is like high bp, but in case there is also low bp. Low bp is also termed as hypotension. So the management of hypotension is different from hypertension. And definitely, um, in cases of stroke, anticoagulant are being prescribed by the doctors, so that platelets like clot doesn't form, or there is no obstruction to the blood supply, so that your brain get enough oxygen for its function. Definitely, try to consume less amount of tobacco, smoke less, and definitely do a regular exercise. Definitely you will see the result. um, Try to sit in the shade when it's too much heat, scorching heat, because heat is something which human body can't tolerate. Like, I don't say that people can't tolerate it, people do tolerate, but there are a lot of people who really, it's very difficult for them to tolerate heat or temperature. So yes, it rises the blood pressure of the person. Along with that, try to sit in the shade. Drink plenty of water. um, Fruit juices can help, so you need to consume a proper diet. Along with that, fruit juice fruit juice is very beneficial for such kind of patient. There are many anticoagulant drugs like warfarin. Again, after the consultation of the doctor only, you will consume, or a doctor gives. You can't, like a stroke patient can't consume like that also, so they have to consult the doctor and then doctor will prescribe. But definitely these are some anticoagulants that has been prescribed. There are a lot of drugs in Ayurvedic medicines to lower the BP. Uh, Sarpaganda is being prescribed, again after the consultation of Ayurvedic doctor. You will consume, but that is how it is being managed, and you are being treated. So yes, if you uh, feel dizziness, or you think, I'm not feeling well, or it's high temperature, and um, your old age, like, you're suffering from high BP, and you are in your older days, you are in old age, so you should avoid and take precautions while stepping out of your house. And definitely it's really very difficult, but and definitely try to reduce uh, the stress content, or you can say live a healthy and happy, prosperous life, not a stressful life. So avoid the stress in your life, guys. Definitely, um, you should avoid the cholesterol rich food and fats, so to prevent any obstruction to the blood supply, arterial supply, so that there is no plaque formation in the arterial wall. So yes, managing the cholesterol, avoiding too much oily food, ghee, fat rich food, also it's just important. So guys, yes, oxygen is the therapy finally. um, तो आज के लिए इतना ही। मिलते हैं आपके साथ नेक्स्ट ब्लॉग में। टिल दैट, डू वॉच, शेयर एंड सब्सक्राइब टू माई चैनल, एंड बाय बाय, सी यू।